Hi, my name is Vaughn and I am from Group 8 and we're going to present to you mental health issues and concerns of the LGBTQ plus community in Canada. At the end of the presentation, you'll be able to understand the definition of LGBTQ, statistics related to LGBTQ community in Canada, the definition, financial support, the knowledge of general public about LGBTQ, major issues of the LGBTQ community in Canada, mental health concerns and how can we eliminate the mental health issues of LGBTQ, government and legal acts that support the community, and the nurses' roles and responsibilities to provide care to LGBTQ plus community in Canada. So first, let me explain to you what is mental health. So according to World Health Organization, mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So LGBTQ mental health is likewise shaped by a sense of self-worth, the level of stress to which people are subjected, and the inclusiveness of their workplaces and community culture. Next is LGBTQ mental health. So LGBTQ mental health must be understood in the context of historical and ongoing pathologization of LGBTQ identities. So in the year 1986, the American Psychiatric Association delisted homosexuality as a mental disorder. And the World Health Organization removed homosexuality from its list of mental disorders in 1990. Despite this, significant stigma is still attached to same-sex attraction in many cultures. And trans people continue to pathologicize as having gender identity disorder, which continues to be listed in the DSM as a diagnostic category. So, mental health of LGBTQ people. So, large Canadian studies indicate that LGBT people are more likely than heterosexuals to report unmet mental health needs and were more likely to consult mental health practitioners. There's also a study found that high rates of depression or anxiety, OCD, phobic disorders, suicidal thoughts and acts, self-harm, and alcohol and drug dependence among LGBTQ people. LGBTQ people are 1 and almost twice as likely to experience likely childhood maltreatment, interpersonal violence and personal loss, and are at double the risk of developing post-traumatic stress disorder as their heterosexual peers. And there's also meta-analysis studies found that sexual minority individuals were 2.5 times more likely than heterosexuals to have attempted suicide and had a risk of depression and anxiety 1.5 times higher than heterosexuals. So sexual minority women were particularly at risk for substance-related disorder, while sexual minority men had a high risk of suicide. That's it for me, and the rest are for my group. Okay, thank you.
Sukhpreet Kaur. Today I am going to define the definitions of the LGBTQ. First of all, the L stands for the lesbians. According to the Wikipedia, the lesbians defined as a homosexual women. Moreover, they have a same-sex attraction. And the G stands for the gay. It's defined as a homosexual relationship between the two men. Then B stands for the bisexual. The bisexuality is a romantic and the sexual relationship between or towards the one gender or the one sex. Then the T stands for the transgender and the transsexual. The transgender people gender identity does not match with the sex they got at the birth time. And transsexual defined as the people who want to change their gender permanently with the help of the medical technology, for example, males to the females and females to the male. Then the Q stands for the queer. It's the term used against the LGBTQ community. Now we will discuss about the governmental and the legal acts for the LGBTQ. First of all, I will describe the Omnibus Bill. It's a private sexual acts between the two people over the age of 21 which treat treating gay, lesbian, bisexual equal under the law. In 1977, Quebec amended the Provincial Charter of Human Rights by becoming the first jurisdiction in the Canada. Then we have the Canadian policy in the military that came in 1992, which allow the LGBT people to work openly in the military without any discrimination. Then in 1996, Canadian Human Act came, which provides rights to the Canadian humans and declared by the Parliament that lesbians, gay and bisexual Canadians have the equal opportunity like the another individuals to live. Now we have the Canadian Human Rights Commission. It monitoring the application of the Act. It includes the further information of the human rights and the sexual orientation. Then the Bill C-23 came that was passed in 2000, which provide the same-sex couples including same social and the tax benefits as the heterosexuals in the common law relationship. Then the Civil Marriage Act came in 2005, which allow them to marry anywhere in the Canada and become the milestone for the sexual orientation. Now we will discuss about the community services and the organizations for the LGBTQ. First of all, I will discuss the Eagle Canada. It is a charity contributes by advising gay and lesbian equality issue by providing the information about the sexual orientation as a prohibited grounds for the discrimination and recognizing the same-sex relationship by interviewing in the front of the Supreme Court of Canada. Now, the next one is the LAMBTA Foundation. It is a non-profit organization. The philosophy of the organization is encourage non-discrimination by tearing down the misconceptions. Moreover, it promotes the research of the gay and the lesbian issues, which is done for the purpose of the public education. Now, we have the Play Canada, the PFLAG. It provides the education, sports and resources on the issue of the sexual orientation and the gender identity. It supports in the growth of the gay, lesbians, bisexuals, transgender, transsexual, two-spirit, intersex and the queer. Moreover, it questioning the persons and their families in the Canada. The next one we have the Welcome Friend Association. This association provides a training, sports, support and outreach for the other communities and organization for understanding the lesbians, gay, bisexual, queer and the transgender community. The next one we have under the community services and the organization of the LGBTQ, the Family Service Toronto. They provide the programs which include the counseling for the LGBTQ community. Then the next one we have 519 Church Street Community Center, which is located in the Toronto. This program focuses on the LGBTQ community. Then we have the Trans Lifelines. It's a free helpline for the people for the transgender. They can call anytime for the help. Thank you.
My name is Roshni. Today I am presenting the topics Statistics of LGBTQ population in Canada and the financial support to the LGBTQ community and individuals in Canada. Firstly, the statistics of LGBTQ population in Canada are taken from the Statistics Canada based on the census 2016. And according to the 2016 census, there were 72,880 same-sex couples in Canada in 2016, representing 0.9% of all couples. And after the legalization of same-sex marriage in Canada in July 2005, the number of same-sex couples increased much more rapidly, that is 60.7%, than the number of opposite-sex couples. And 1/3 of all the same-sex couples in Canada, with a slightly higher percentage among female couples than male couples. And as in previous census, Ontario, Quebec and British Columbia had the most number of same-sex couples in 2016. The total share of Canada's same-sex couples lives in these three provinces declined from 84.3% in 2006 to 81.2% in 2016. In 2016, Ontario continued to have the most number of same-sex couples of all the provinces with 26,585 couples. However, both Quebec and British Columbia had more people living as part of same-sex couples relative to their total adult population. While this percentage was 0.5% for Ontario in 2016 and it was 0.6 for Quebec and British Columbia. And when it comes to the transgender population, the official statistics data are not available because it was not included in the previous census. But many organizations and people raised their voice to include third gender in coming census in 2021. Importantly, the Registered Nurses Association of Ontario sent a letter to the Honourable Minister of Innovation, Science and Economic Development of Canada in August 2016, addressing the inclusion of gender identity and sexual orientation in Census 2021. And the CBC News report in December 2018 that there will be inclusion of gender identity and sexual orientation questions in the Census 2021. And next, let's move on to the financial support to LGBTQ plus community in Canada. The government is giving $770,000 to the Eagle Canada Human Rights Trust on the 50th anniversary of decriminalization of homosexuality in 1969. And this fund will provide to the Eagle Canada Human Rights Trust is a non-profit organization that works to improve the lives of lesbian, gay, bisexual, transgender, queer, intersex, and two-spirited people in Canada and around the world. And also, in November 2018, ahead of World AIDS Day on December 1st, the Honourable Minister of Health announced a significant investment to support community-based initiative to prevent infections among gay, bisexual, transgender, two-spirited, and queer men in Canada. And also, the next important grant is Rainbow Grant by the Community One Foundation. This is Community One Foundation providing rainbow grants to LGBTQ community in the areas of health and sciences, social sciences, arts and culture, research, education and advocacy. Foundation Rainbow grants are available up to $7,500 and are open to registered charities or group trusted by the registered charity. And general Rainbow grants are available for up to $1,500 and are open to groups or individuals without charitable status. And this grant is available to registered charity up to $10,000 in the following key areas: seed new and innovative projects on combat discrimination based on sexual gender identity and create an atmosphere for respect and acceptance. Support needed but underfunded services to LGBTQ individuals and families. And also provide programming specifically aimed to support newcomers to Canada who have identified themselves with LGBTQ community. And next is LGBTQ centers. LGBTQ centers are places on campus that provide resources and support for non-straight and straight students. Depending on the campus, an LGBTQ center mission may include faculty support, student advocacy, alumni relations, and public relations with gender-queer community. Some LGBTQ centers may provide financial aid to students such as scholarship, research grants, or work opportunities. This can be especially important for LGBT students as unsupportive parents may withdraw their financial support upon learning of their child's sexual orientation. So these are the important financial support to the LGBTQ community in Canada. Thank you for listening to me.
Hi, my name is Harpreet and today's my topic of presentation is LGBT community major issue about their health and mental health. They are facing lots of issues in their life like stigma, discrimination, harassment, they live in verbal abuse, sexual abuse and low self-esteem. Mainly they are facing, if it starts from when they are in school age, like this it starts from middle school. They feel that time they recognize their sexual identity and they want to be called by he or she, and you can see the survey how negative school climate impact on their outcomes of academic studies. And according to survey this they took the sample youth of 5,700 and they found that their academic outcome was very low because they were discrimination, they were facing slur, they were victimized, and they are missing schools for because of discrimination. And other impact on their life is socio-culture factor like homo, bi, transphobia, heterosexism, family, friends and partner rejection, discrimination at work and religious places, and they live in violence, poverty and racism and with stigma. Another factor is psychosocial, like they whole life they feel like loneliness, social isolation, low self-esteem, lack and shame and guilt, hopelessness and worthlessness, they feel difficult to build trust with others because of their sexual identification. Psychological symptoms, what they actually their body gives them: anxiety, depression, suicidal ideation, anger and frustration and worthlessness. And what the word will think about them is, word view is, you can see the United States, they are more aware and more westernized countries, still they are facing sexual abuse, and in different countries like Uganda, Russia, everywhere they are not openly accepted for their sexual identification. Even in Bangladesh, in India, they were killed because of their sexual identification. And public opinion, what public think about them, like they feel social acceptance, they are not public is not accepting them socially, and if they coming out, parents get upset when they don't want to hear their kids should say one day that they are gay or lesbian or transgender. And religious is the major part of everybody's life, because everybody gets the values and beliefs from the religion, but religious people are not accepting them, they are not welcoming and friendly to LGBT community. Society not that open. Respondents say, but these according to Ontario survey, these are less than 10% of LGBT respondents say that they are totally accepted. 45% says not welcome. 81% says that willing to accept, but 54 saying not they are not most welcome. So we can see from all these data that they are suffering. 81% of LGBT individuals feel distress, loneliness, isolation, discouragement, and their sexual because of their sexual orientation and gender identity. Here is the Plague Canada. You can see that these are the few icons factors showing that how much percentage like student school age racism. Here they left the home, do the suicides, and all this shows how much they are getting discrimination from the community. Thank you so much. This was
Hi, my name is Dolly and I'm here to present the nursing interventions when caring for LGBTQ patients. Number 1. Expand your knowledge about sexual orientation and gender identity. To understand the needs of LGBTQ patients, nurses must expand their own knowledge on the subjects of sexual orientation and gender identity. Number 2. Know key LGBTQ definitions. Read about the meaning of asexual, gay, lesbian, bisexual, pansexual, and queer descriptors that fall under the sexual orientation umbrella. Queer, formerly considered a derogatory term, is now considered by some to be a more fluid and inclusive descriptors than other words related to sexual orientation. Number 3. Deepen your LGBTQ knowledge. Deepening your knowledge base will enrich your understanding of sexuality in general and increase your nimbleness in identifying potential health risks for patients seeking your care. Keep your knowledge up to date with ongoing training, reading and learning from others who are skilled in communicating with and caring for these patients. Create a welcoming environment for LGBTQ patients. LGBTQ individuals have a long history of discrimination at the individual and institutional levels, including the healthcare system. Number 5. Use inclusive language. When asking patients to provide their names, include an additional space indicating preferred name, as a transgender individual may not wish to be called by a name that reflects their gender identity. Number 6. Use general neutral language. Approach each interaction with open-mindedness and a non-judgmental attitude. Remember, your job as a healthcare professional is to assist the person in solving a health concern or reducing the risk of future health problems. Number 7. Ask open-ended questions. Do not overwhelm patients with questions unrelated to the reason for their visits or to enhance your own knowledge about transgender health. Focus on the behaviors impacting health rather than sexual orientation or gender identity per se, so the conversation can positively influence health and foster acceptance. Number 8. Reflect the patient's language. Avoid applying labels such as gay. Some people do not self-identify with any particular descriptive label, yet may have sex with partners of more than one sex or gender. Do not presume. Number 9. Investigate mental and physical health risks for LGBTQ patients. It's also important to build your awareness of the specific physical health problems of LGBT individuals. Example, lesbian women are more at risk for certain cancers due to the prevalence of obesity, nulliparity, or later pregnancy. Lesbian women are susceptible to many of same sexually transmitted infections as heterosexual people and gay men. Number 10. Convey respect. Always remember that the LGBTQ patients in front of you have taken a courageous step to be in your clinic, hospitals, and disclose some of the most personal information about their lives. Having as positive and affirming an experience as possible will make it more likely the individual will seek future care in a timely manner. To eliminate mental issues, the following are the recommendations. First, increase awareness of the broader social and legal context in which LGBTQ clients live. Become familiar with the degree to which internalized discrimination can impact on health. Develop understanding of the social determinants of physical and mental health with LGBTQ communities. Provide appropriate equity training to ensure that suicide response and crisis interventions staff approach LGBTQ clients without stereotypes or discrimination, and that gender of trans clients is not misidentified. Improve recognition that individuals who belong to multiple marginalized community may face additional barriers to maintaining good mental health. Increase familiarity with resources to support LGBT people at greater risk for suicide, including youth and trans people. There are some resources available, and one of them is the Rainbow Group Ontario, and there's a kid helpline, and also for lesbian or LGBTQ community. Thank you.